Good morning. I'm Peter Cordell, president of Norwalk Hospital. The site of the press conference, had we had the luxury of being in person, but we are all too familiar with Zoom right now and conditions being, it is safer to have this press conference virtually. Nonetheless, every day is a beautiful day for a virtual press conference. So without further delay, it is my pleasure to introduce Dr. John Murphy, president and CEO of Nuvance Health.
Thanks, Peter. You're doing a great job hosting this virtual event, by the way. So thank you. I'm sorry we're not all together in person. And thanks to all of you who are attending this session today. It's a great privilege and honor to be with you. And I wanted to also call out a couple of special guests. We're delighted that the Madrigal family is here. We have Tanya, who'll be speaking to us in a little bit. Thank you, Tanya, for making yourself available. And certainly Jim Schmerling, who's the president and CEO of Connecticut Children's Hospital. It's a great privilege to have you with us. And also Dr. David Sink, who's the regional clinical director. Thank you for making the time to be with us today. And as all of you know, particularly you parents, having children can be a wonderful time and can also be frightening at moments when they're particularly ill, or if a child is ever hospitalized, it can be a scary time. And, we've been thinking about that and recognizing that being able to provide a great care to our kids in our communities is essential for us in terms of providing comprehensive clinical care to our communities. And it's also been in the news very recently about kids going back to school, having ready access to clinical expertise when it comes to the pediatric population, including subspecialty expertise, is growing increasingly important. And with that as a background, I'm pleased to announce today that Nuvance Health has expanded its collaboration with Connecticut Childrens to make it easier for parents to get the care they need for their children in both Western Connecticut and throughout New York's Hudson Valley. Through this new pediatric alliance, Connecticut Children's experts will provide care to infants and children of all ages across the entirety of Nuvance Health's system and the pediatric services that we want to offer. We've been working side by side with Connecticut Children's for years in both Norwalk and Danbury, and the collaboration has been fruitful, productive, and I think our communities have benefited enormously from that work. We've seen wonderful outcomes, and you'll hear more from Tanya about that in a few moments. And so with this alliance, we are bringing their advanced pediatric services to all of the communities that we serve, with a shared mission of improving the lives of our littlest patients, whether they are born prematurely or need emergency care or have a chronic condition. This is very important to us. We think promoting the children's health is vital to who we are and what we want to be. And with that, it's my pleasure to introduce to you the president and CEO of Connecticut Children's, my good friend, Jim Schmerling. Jim?
Thank you, John. And it's a great honor to be here with you and our colleagues at Nuvance Health. We are excited about the opportunity to expand our relationship, formally committing to positively impacting the lives of even more children across the state and throughout the region. Connecticut Children's Alliance with Nuvance Health guarantees the right care is available to children and families when and where they need it, giving them the greatest access to our pediatric expertise. It means that families will hopefully find it easier than ever to make appointments, find physicians, newborn intensive care unit if they need it, emergency and inpatient care that works for them and their child from infancy to young adulthood, including transitions into adult care through our partnership with the Nuvance Health System. Our alliance builds on a tremendous relationship that we've established since 2018, including right here at the Norwalk Hospital, where our neonatologists take care of babies in the NICU every day. We'll create standards of care in all the Nuvance Health newborn nurseries and NICUs, building upon the Connecticut Children's nationally ranked model of neonatology care, and partner to expand our services to the emergency departments and inpatient care. Through our alliance, Connecticut Children's will be a pediatric partner of choice across the Nuvance Health healthcare delivery system, making our highly skilled pediatric experts and specialized programs readily available to children who may not have had access otherwise, thanks to more locations that are close to home and through video visits. Partnerships like this will help create integrated care models that positively impact children while leveraging our expertise as an independent pediatric health system. One of our greatest attributes as an independent pediatric health system is our ability to collaborate with others, including adult health systems just like Nuvance Health. By working together, we truly will make a difference in the lives of children. Children like 9-week-old Matias Perez, who's with us today. Matias was born right here at Norwalk Hospital at just 26 weeks gestation, weighing 2 pounds and 2 ounces. He's just one example of our partnership in motion. Matias had abnormalities with his electrolytes that were corrected with the help of Connecticut Childrens dietitians up in Hartford. They were a readily available resource for all of Nuvance Health's pediatric patients, and it's just one example of many that will allow us the best care to be provided to babies like Matias without having to transfer him out of his hometown. The care can be provided right there in Norwalk. All children like him deserve the best care close to home, and our partnership is doing that every single day. But you don't have to just take it from me. Mom, Tanya, is here to share her story and tell you a little bit about the quality of care that she and Matias have received from Connecticut Children's and Nuvance Health. Tanya?
Hi, how are you? My name is Tanya Madrigal. I'm Matias' mom. Everything started June 11, 3 months before my due date. That was a normal morning for me. I was getting ready to go to work. And then is when I feel fluid coming out. I go to the bathroom and I check myself. There was blood. I see blood. I call my doctor and she told me to go to a delivery room. Then this when everything started. I was very scared because that was 3 months before my due date. I got to the hospital and then they check me out. They do everything they can do to stop the bleeding, but nothing worked. They told me that I need an emergency C-section to save Matias' life and my life too. And that time is when I find out that I need an NICU for Matias. All the doctors and nurses from Connecticut Childrens, they're great, they're awesome. They do everything they can do to save our lives. But the first day that I see Matias, he was connected to all those cables and machines. I was so scared. The first thing that came to my mind was that he was not going to make it. He received 2 blood transfusions. He got 3 brain ultrasounds. Then I never know that they happened to a baby. Into that day, he got a hernia removal in Hartford. They take him to the Hartford hospital by ambulance. I drive all the way over there by myself at 4:00 a.m. But thank goodness everything go fine. And he come back the same day to the Norwalk hospital. I only want to say thank you for all they do to us, to Connecticut Children's, to save our lives. That was great. They do everything they can do to save our lives. And today he's coming home after 76 days in the NICU. He's coming back home.
And Tanya, this is Monica. I head up strategic communications for Connecticut Children's. I want to go ahead and share a slideshow here of photos of Matias and just showing you how far that he's come. Tanya, what was it like knowing your baby had access to the best pediatric experts in Connecticut?
I was very scared. To be honest, I was very scared. I was thinking that he was not going to make it, but they are great. They give me a lot of support. They help me in many ways. I was very scared, but thank goodness everything go well. And all the support that they do for me and for my family, because I was thinking that he was not going to make it. I'm sorry, I cried. I'm so sorry.
We understand. And we're so happy that he's doing so well as we kind of progress through these photos, especially this one. It's my favorite. Just as we close up here, just tell me what kind of baby, what is Matias like as a baby?
He's an amazing baby. He is smiling every time. Every single day he's smiling. He have a smile for mommy every day.
Wonderful. Thank you so much for sharing your story with us. We really appreciate it. And he is just a wonderful little baby, and congratulations on him coming home today. That's such a huge milestone, and we'll be here to support you as Matias continues to grow.
Thank you.
Thank you, Tanya. Now with that, I'm going to go ahead and introduce Dr. David Sink. He is the Quality and Safety Officer and Regional Clinical Director for Neonatology Services at Connecticut Childrens, which of course now includes Nuvance Health. So Dr. Sink, if you'll take it away.
Thanks, Monica. And oh my gosh, Tanya, I'm so happy to hear the great news about Matthias going home today. I know it's been a long journey. I'm a neonatologist and know very well how long the journey is in the NICU sometimes. So I'm just thrilled for you. Congratulations and wonderful to see Matthias doing so well. So I am very excited about this alliance between Nuvance and Connecticut Childrens. I've been a neonatologist at Connecticut Childrens for over 10 years now, and over the past 3 years, as our collaboration with Nuvance has grown, I've had the pleasure of working as a Connecticut Children's neonatologist alongside the staff at Nuvance in the NICUs at Norwalk Hospital, at Danbury Hospital, and I've spent quite a bit of time over the past year with the team at Vassar Brothers in their NICU. And while in those NICUs, I've also interacted frequently with Nuvance teams in the birthing centers at Sharon Hospital, Northern Dutchess, Putnam Hospital. And I'm very impressed with the care provided in these centers. And I'm very happy for what Connecticut Children's can now do to better support these teams. Our Connecticut Children's medical providers in the Nuvance NICUs and pediatric floors are part of our closely knit academic department of pediatrics. These providers bring the knowledge and expertise of really a top tier academic children's hospital to these Nuvance pediatric patients. Many times over the last 3 years while working at these Nuvance sites, my colleagues and I have reached out, as Dr. Schmerling mentioned, for advice on managing some very challenging patients. This allows us to elevate the care that we can provide to these patients in their home hospital. We're already sharing pediatric evidence-based clinical practice guidelines, clinical pathways developed in the Connecticut Children's Hospital with our teams in the Nuvance sites. We're also leveraging partnerships that Connecticut Children's has with national pediatric healthcare quality collaboratives and the Connecticut Children's Continuous Quality Improvement Team to really bring the best pediatric and neonatal practices to Nuvance and their patients. In addition, we're looking for other ways that we can help the community served by Nuvance by bringing our expertise and services in pediatric behavioral health closer to home, to be there when it's needed. And we know this is really incredibly important to families right now. Back to school is on everyone's minds right now, and Connecticut Children's is there to help. Unfortunately, COVID-19 and the Delta variant are here. And while Connecticut and New York have done a great job in helping to stem the tide in our region, we all have to do our part to protect the vulnerable in our communities, which includes our young children. Parents, masks are still very important and go a long way to reduce the spread of the Delta variant and to keep our children in school where they need to be. Hand washing is another very important preventive measure, so keep reminding your children to wash their hands frequently. I'd like to also share some other great resources for parents and their children. ConnecticutChildrens.org on the internet has timely topics written by our pediatric subspecialists, our infectious disease specialists, behavioral health, and other specialists related to COVID-19 and return to school. Many answers to questions about vaccinations in adolescents and hopefully soon in our younger children, as well as great information on pediatric behavioral and mental health in these challenging times. Also, there's a Connecticut Children's app you can get for your phone or your tablet. You can find a doctor from over 30 specialties in pediatrics at Connecticut Children's, as well as find a location to see these specialists closer to home. You can access even your child's own personal health information via a link to our secure Connecticut Children's MyChart application. And I can tell you, I've put this app to good use when my own children have needed care at Connecticut Children's. So in summary, I'm very excited about this partnership and this Care Alliance with Nuvance, and I look forward to continuing to bring the best pediatric and infant care to children and parents in your community. Thanks, everyone.